Welcome to Chapter 5. We are going to begin talking about the physical and cognitive development in infancy and toddlerhood years. So, the first part of the chapter really talks about developmental milestones, growth charts, etc., for babies and toddlers as when they go in for their well checks. Physicians are looking for these things. Why do you need to know this? So, you'll have people who come in for counseling who are pregnant, who have babies, who may come in concerned about milestones. You may work with children, you may work with toddlers. So these are really important things to know because also in your intake packet, you'll ask these questions. It can give you an idea of what could be going on with someone. So did you meet your developmental milestones as a child? Um, and that can be, it's something I ask. So I think, especially with EMDR, I want to know what the womb was like for the infant. Was there womb trauma in the womb? Was there traumatic incidents when they were um, infants that would have caused developmental delays? So if you're wondering why are we going over all this, that's why. And also because it'll be on your test. So it'll be on the CPCE and CE again, and your quizzes 1 through 5, by the way. If you're up to date and watching your lectures, your quiz is going to be through this chapter. Please make sure you read, and please make sure that you watch all of these fun videos with your forum prompts embedded in, and sometimes little treats like extra credit. So here's an example of a chart. I thought we would start with this. So you see, this is a developmental milestone chart. I'm going to just scroll up. I think I'm going to scroll up here. You see on month 1, eye contact, stare at face, respond to parent's voice. So you see these milestones and the grasping. We'll talk about 4 months begins reaching, using arms, grasping, releasing, hands together. You see, they're looking for these rolling over. These are the milestones. So these are some of the things that are in this chapter and some of the things that we're talking about with that grasping reflex. You see that on page 116. The blink reflex, all the reflexes, you'll need to know those, but they're looking for those when you go in for those well checks with your baby. Okay. And here's a whole look at that every month. I just found this on Google. I just thought it was maybe more interesting than listening to me talk about all the other stuff. I think I had another one I wanted to. Let's see. There's plenty of charts for you guys to take a peek at. Let's get back to the fun PowerPoint here. All right, this is chapter 5. I skipped the first 2 slides because they were just the title, etc. This is the physical development, and this is what they're looking at. What's happening with your baby? So it's the period of most rapid growth occurs from birth to 1 or 2 years of age. By 5 months, the baby has doubled in weight and length, and of course, a newborn's head is always bigger than the body. A boy toddler at 2 years of age has grown to half his adult height. Crazy. And a girl by 19 months. And this is important to note. A child who gains weight too rapidly during the first 2 years, they double their risk of obesity compared to a gradual weight gain, and they will plot that on that chart. Let me pull that up so you can see that growth chart. I feel like I should go pull my children out, but every time you go for a well check, when you have an infant and toddler, they still do this every year when we go for the kids checkup. They measure them height and they weigh them based on their age, and then they have this graph and plotting it, and that's how they can tell where you are in the percentile. And so if a child had too much weight, they would be off in the percentile range, so they would be at risk for obesity. So that's how they kind of chart if you're on track for in a healthy way growing. So also if excuse me guys, if your child's not growing, right, they're too short or they're too skinny, then the pediatrician will talk to you about, hey, what's going on? Are they eating okay? They might have an allergy, um, etc. So that's just basically what they're talking about. So you need to know that because um, people can come in and talk about that. They'll say they're not meeting their milestones, especially if you're working with kids. And you'll need to know what those milestones are and be able to understand why that's important and why that's noteworthy for you as a therapist. Okie dokie. Back. All right. The most accurate estimate of an infant or toddler's physical maturity is obtained by determining their skeletal age. All right. So, one thing I did want to note also is there's a difference in weight um, for breastfed. So, the differences in body sizes for infants who are breastfed or formula fed um, can be very different, and definitely breastfed babies are ideal, and that's what you want. But that's not necessary here. Okay, here's the other thing we need to talk about. That is something that is not possible for a lot of people or women, and it's very shame based. And so women are very pushed to do the breastfeeding because it is best for the baby. But sometimes there are issues, lots of issues with that, and it can be so you could have postpartum moms coming in and feeling like failures. I can't even tell you how I do a lot of holistic women's health and I have a lot of OBs that refer to me. So you know you may not get a lot of this depending on where your area is, but just so much shame for not being able to do that or not producing enough milk and just feeling stupid. That can really add to postpartum depression. So really important. So we're talking about two things here, but just wanted you to know why that could be really important for you to know and making sure that your clients feel okay. Because sometimes people just can't, they just can't. And sometimes, honestly, sexual abuse survivors have a real hard time with breastfeeding because of the way the messages that were sent to them as a child. And if they'd done trauma therapy, they probably wouldn't feel that way. But most of them come to me maybe after they've had children, and so we haven't worked through that stuff. So, um, you always, again, no judgment, right? Just completely supporting them where they are. But the most accurate way to measure is that skeletal age, and the only way to do that um, is take an X-ray of the child's hand and wrist and compare bones in this area to standards of bone growth on X-rays in an assessment atlas. The epiphyses is the active growing areas at the end of each growing bone. Examine to see how much soft cartilage has not turned to hardened bone. An interesting fact, fun fact, it's not a fun fact, I guess, but my daughter, Helen, she's had 7 surgeries, and it was because of this very thing. There was a cyst right there between the femoral neck and the hip socket. There was in the femoral neck a cyst, unicameral, non-cancerous, right next to the growth plate, and the soft cartilage could not harden because blood couldn't get to the femur, and she had a couple of fractures and half body casts and several surgeries. She actually had to have tons of hardware put into that femur to keep it stable so she wouldn't have a clean femur break because it would come back so rapidly at times that we couldn't catch it. The doctors couldn't catch it in time. They would think she was good and then she wasn't. So that's just another interesting thing to note that might help you think about epiphyses. Hey, I just used you in my lecture. I just talked about your surgeries. Do you want to do a cameo? Do you want to talk? Do you want to say anything? You want to tell them about all your surgeries? They're not really on here now, but they'll listen to you later. I hope they'll listen to you anyway.
Oh,
Hmm?
don't like it.
You don't like it.
No, it's very difficult.
It's very difficult.
Because then you can't go to school for
Yes, and you had to be on a walker for a whole month, didn't you?
a while.
Mm-hmm.
Some people for it, but
Mm-hmm.
they said, we're no Grammy.
Yes, and Helen had to go to school in a walker, and then she was bullied some, which we're going to talk about later, but then it was all okay, right?
Mm-hmm.
And that doesn't happen anymore, and that was not nice.
Yep.
Okay, thank you for your input. All right, so that was sweet little Helen's little input. Isn't that terrible that they bullied her for being on a little walker? Anyway, okay. So just like um, height, the fat composition increases rapidly from 13% body fat at birth to 20 to 25% body fat by the first birthday. Muscle growth increases and continues steadily into adolescence. So here's another fun fact. I guess not really fun, but Helen doesn't have to worry about. We don't have to worry about the cyst anymore after she's almost fully developed. So about 16. So we go every year, sometimes twice a year, for X-rays to see how she is coming along, and that is because she's still growing. So the, everything is still developing. The bones, right, the muscles, or maybe sometimes it's good to have an example. There are notable differences in muscularity in infants and toddlers who were born small for their gestational age are large for gestational age. Again, you're plotting that, right? Teething becomes a process at 5 to 9 months. The average infant has 6 teeth by 12 months, 12 teeth by 18 months, 16 by 2, and 20 by 2.5. And there's variability among children is due to genetic factors. So just so you know, kind of trying to keep you aware of why you may need to know these things. You may have parents, fathers, mothers coming in with children who are crying, who are not sleeping, and sometimes there's some psychoed to what we do, right? And so, if you know these developmental milestones, you're like, wow, I wonder if they're teething. You may get new moms, young dads who are lost and have no idea what any of these things are. Sometimes we get people who've never been to a childbirth class. They've never, we have teen pregnant moms, etc. We have people who just don't have support. And so sometimes, guess what? You're the support. So sometimes it's a psycho ed where you kind of flip in and go, oh gosh, it sounds like maybe they're teething. How much do you know about that? And you might even pull out your phone or your computer while you're in session and go, hey, this is what's normal when they're this age. So just always following that client, knowing what's going on because you're there to help. And that's not advice, that's education. So, we're not telling them what to do. We're just sharing information about the developmental age of that child. I've had all of these situations that I'm referencing. Of course, I'm scarily just remembered that I've been in the field since '05, which almost means I've been in the field for 15 years. I didn't get graduate with my master's until '08, but I was counseling since '05, which is I shouldn't have not really counseling, but doing groups and stuff. So I shouldn't have been, but I kind of cringe when I think about that. But I made all the mistakes, so I can teach you guys how not to. All right, let's talk about these reflexes. These are the things that the doctor is going to be checking for. They're going to be checking for the grasping, the sucking, the rooting, the diving, etc. Diving only if you put the infant in the pool, of course. But you know how when you guys hold a baby, some of you may have some of you have babies but when you put pressure in the baby's hand, the baby clenches the fingers around like your finger. You guys know when they hold your finger, it's so sweet. That's a grasping reflex. Pacifier, sucking reflex, bottle that they're suck when something is placed in the mouth to eat, and if that's not happening, then something is wrong. When they're rooting, so they will root and look for food for the breast. So basically, if you they will start kind of turning their head and mouth toward, and they're looking for the milk. That's what they're doing. Um, so when an infant is immersed in a pool of water, he will hold his breath and open his eyes. Of course, they have those baby classes for swimming, and you can actually teach a baby to get to the side of the pool. It's pretty cool. But anyway, they have those baby swimming lessons. A blink reflex is when when there's a flash of light and the baby blinks. Remembering that reflexes, they're automatic and hardwired responses to stimulation. There's no cognitive ability in that. It happens automatically. So there's the Dubinsky reflex, and that is when um, the bottom of the foot is stroked, that the newborn's toes flex, and no matter how that is done, it still happens. That also suggests there's no cognitive control over reflexive movement. I don't know if you guys have ever I'm sure you've had your knee tapped for reflex test. That's the same thing. I mean, you're not making it do that. You have no control over that, right? When the doctor hits your knee with the a little hand with a little rubber mallet, and you have your leg kick out. And then there's another one that's the Moro reflex. I remember doing this and checking it with my children because I knew about it. And the infant stretches out the arms, legs, and fingers while elongating the neck muscles. When an infant is moved suddenly or hears a loud sound, it's really actually. Why don't we play a little video of a Moro reflex? Here's the Moro reflex. See that? Oh, thing. This is Babinski. That was Babinski.
Neurological of the condition. To test the more reflex, hold the infant's hands and pull forward until her head is a few centimeters above the back's neck. Drop her head gently into your other hand. Her hand should open and her upper extremity should extend and then retract. The palmar grasp reflex is easily elicited by pushing the fingertip into the baby's palm, causing her to wrap her fingers around yours. The rooting reflex is evaluated by stroking the infant's cheek, leading her to start suckling her mouth in anticipation of a feed.
And those were some videos just showing you breaking up this PowerPoint so you can kind of see what they actually look like if you've never seen them before. And then we also have one reflex we have in common with apes is the post-auricular reflex. And when an animal feels attacked, it pins its ears against its head. This is a movement accessible to humans only as infants, but it is not a fear-based response in us. It's positive. It's more used when they're ready to feed, that the ears are pulled back. And then infants have reflexes that preclude movements they're not fully capable of making. One is the locomotor reflex, known as the stepping reflex. Okay, so when the baby's I don't know if you guys have ever watched kids or you have nieces or nephews or children where you hold them up and they do the little stepping reflex. It's kind of prepping them to get ready for the next, for walking, right? Okay, let's go to nutrition and malnutrition. Everyone knows the definition of nutrition, right? And the American Academy of Pediatrics recommends beginning breastfeeding within the first hour of birth and continuing exclusively for 6 months. We talked about that already and just being really cautious with your clients because sometimes there's a lot of pressure to do with that and not everyone can and it's not easy and before you have children you don't really understand that. I certainly did not. It was very difficult for me, but I did it. It was not, it was very hard. And so some people it comes easy, some people it doesn't. But there's a lot of benefits for breastfeeding. So if sometimes clients may come in and they want to talk about their decisions and what they want to do. And so you just have an idea of what this is. Really strengthens the immune system, minimizes allergies later in life, and lessens the risk of disease. So I get why there's so much push in the hospital, but sometimes people just can't. And so, gosh, I get so many people who come in and just feel really badly about not being able to do that or really conflicted. Ooh, mirror neurons. These are my favorite. We still keep these guys all through our life, right? These imitate behaviors. We keep these when we are in, this is what I talk about with body keeps the score. We have these mirror neurons, and so we mirror emotions. If we're not really healthy and at our optimum level when we're practicing, we'll absorb that. That's why when you start in practicum and internship, you will feel very tired when you finish. And it's partly because of this, because you've got to learn how to keep yourself grounded and stable, and it just takes time. and you will. But look at this. This is how you perform. Children get to see, and they're looking, and then they're going to mirror what they're seeing. Um, and they even observe what we eat about 4 months and more likely to eat food the parents eat. So eat healthy. If you eat healthy and you introduce healthy foods, your children will probably eat healthy. Um, that's very important for development. Malnutrition, if the weight for the height score, remember I showed you that chart a little bit earlier? So we talked about those percentiles. So if the weight for height score is less than 80% of the reference group's median weight for height, then there's some concern. Is there enough food to meet the need? Are they having anemia? Are they having an allergy? Um, so very important to note and be aware of when you're evaluating your cases. All right, we're going to move into health concerns. Sadly, guys, I don't have this on full screen because you can't read everything. So I'm going to try it this way and see if this works better. You guys can send me an email and tell me what you like. But um, terrible syndromes, sudden infant death syndrome, it's just the spontaneous death of an infant. You'll have clients who come in who've lost a baby to SIDS in their history, or may currently have lost a baby to SIDS. So there's things that you can do to make sure that the baby doesn't get SIDS. So sleeping on backs, which is the opposite of what we used to do back a long time ago. It was it was it's been changed for a while. Um, Use of vaccines, avoiding um, reduction of SIDS is correlated with the use of vaccines, avoiding smoking, and after birth in the home, using a firm sleeping surface and eliminating any loose items in the crib. There's also shaken baby syndrome. When parents get frustrated and they shake the baby, it's abuse, head trauma, and it's child abuse and punishable by law. But a lot of times people who have children who won't stop crying and they don't have any coping mechanisms, this is where, gosh, you as a therapist will have to be really aware of these things. And if you notice that you're seeing someone, a father, a mother, or relative in the home that's very frustrated, you've got to go into action, get the physician on board, get a release, talk to the OBGYN, really talk about coping mechanisms, talk about support and help. Make a phone call. You may have to report it if you're concerned about abuse. If you're really concerned and you want to do a well check. But, you know, we're kind of the first line of defense sometimes about with these things. So really important to note and be aware of all of these. Vaccines are important during this time. We hear a lot in media about people who are anti-vaxxers, etc. But the overwhelming information is for vaccines, not against. So they immunize the body against diseases by giving a small-scale version of the pathogen. One thing I always made sure to do is if my children were sick or not at their optimum health, I would not get a vaccine. I would put it off for like 3 weeks or a month until they were really healthy. But if they were coming off of something or they had a fever, I was really cautious. So I think sometimes those are really smart things to do just to, you want your child to be at optimum health when they get this invasive pathogen into the body. The body keeps a memory of it. And so if you're exposed to the disease, it will just neutralize it. And there's a schedule of shots if you don't know, and you obviously don't remember because it's been a long time since you've had one, but you get quite a few of them in the beginning of life, and then um, throughout here and there, you get boosters and other shots, etc., etc. Motor development and perception. So, also, we talked about motor development and perception in that first chart that I showed you. That's what they're looking for, right? For these different skills. Are they doing these things? Are they starting to crawl? Are they rolling over? So you've got gross motor skills, which are basically rolling over, crawling, standing, walking, and then fine motor skills. Those are those smaller movements such as reaching and grasping. So you've got that pincher grasp where they're starting to pick things up. The ulnar grasp is the palm to grasp an object. So you see how that's developing. And then pre-reaching, I went backwards, but pre-reaching is when they swipe, but reach it. So you see it's developmental to pincher. And then eventually, can they hold a pencil, etc. when they get older, like 5. sleeping. So newborns should sleep 16 hours a day and have 7 sleeping waking periods, lasting from 20 minutes to 5 to 6 hours. But that is not always what happens. So, by 3 to 4 months, infants sleep 13 hours a day and have 4 to 5 regular and predictable sleep periods, with 2 to 3 occurring at night. And then by 6 months, 12 hours. And you see how the sleep's reducing. And then you still got naps, probably naps at 5 2, napping schedule and sleep schedule, trying to retain the same nighttime schedule. Perception. There we go. This is sensation and perception. How are they experiencing their environment? So, okay, so perception is sensation. So there's external and internal sensations. So sensation is the physical experience of sensory stimuli, so touching, feeling, etc. And perception is how you organize and interpret that input, that sensory input. The two types of stimulation that play a big role in brain formation are exogenous stimulation and endogenous. Yeah, exogenous and endogenous, right? So brain lapse. So exogenous is what's external to baby. Endogenous is internal. And it begins at the firing of those neural cells and leads to neural pathways that are created during REM sleep. And it's interesting to note that in REM sleep, it's rapid eye movement. It's also what we are initiating in EMDR therapy. Both exogenous and endogenous stimulation transport neurons to clusters that eventually create the cortex in the infant's brain. Pretty cool for those of you who love biology. We're going to vision. I think we're going to vision. I want to go to vision. It's not clicking. I'm going to pause it so I'm not wasting your time. There. Don't want to waste your time while I messed with this. I've got us back in the full view here, so see what y'all like better. What's noteworthy in vision is newborns see in black and white, and by 4 months they develop color vision and they shift attention to hands and food. There's a vision screening when the infant's 1 year old that can detect the lazy eye, and I don't know exactly how to say that. Amblyopia? Okay, well, whatever, it doesn't matter. Okay, which is a vision impairment that's preventable and treatable with early detection. Hearing, all right? Infant can learn 60 consonants and 200 vowels of the world's language from 32 weeks to 9 months. Yes, Gray? You're going to get a Gatorade? Okay, that sounds good. Okay, that was for you, Colin. So Colin is enjoying Gray's interruptions of the lecture, so Gray's getting a Gatorade. It's noteworthy. Oh gosh. Sounds to which the infant gives meaning are strengthened through that parent-child relationship. We're cooing that kind of infant. We automatically go into that like motherese, those sing sound quality. It helps them learn actually. So it's pretty interesting. Ideal conditions for auditory development are good REM sleep, alternating periods of sound and quiet, and exposure to interactive conversations. Hello again. You want to say anything?
Hello, my name is Grayson.
Oh, thank you. That was very nice. I'm sure that was perfect for hearing. They heard you introduce yourself. So that was exciting. Little brain breaks, right? These are kind of boring. Okay, so back to taste and smell. Because I had to took a little break. You guys probably didn't realize that, but um, the chromosensory development is really important. So if there are a lot of exposure to things like smoke or perfumes, or there's issues with not with during pregnancy and after, that can override the system. So infants are hardwired to prefer sweet taste because mother's milk is a little bit sweet, like the breast milk. And they need to be trained in infancy to like a wide variety of flavors. So it takes 10 to 20 tastings to accept the taste of a new food. Neophobia is the fear of something new that can develop in toddlerhood. touch. We have touch. There are three kinds of touch, three modalities of sensation. That's three kinds of touch. So discriminative touch is the sensations of touch, pressure, and the vibration. There's also pain and temperature. And that, of course, teaches a lot to children, right? And proprioception, that happens beneath the surface of the body. And that's where a lot of the sensory disorders can come in. That's kind of understanding the proximity of where things are in relation to the body and kind of what your power is. And if you're wondering why infants are constantly putting things in their mouth and grabbing things, it's because that's how they learn. There's somatosensory information. Also, we're not entirely sure about pain. We know now that infants and toddlers experience pain. I'm not really sure why we didn't think that in the first place, but understanding that level of pain. So, especially toddler boys can have problems later in life because they had insufficient pain control during medical procedures. Um, so, noteworthy when you're doing your intake, right? And if they had a medical procedure, early childhood, um, always interesting. You want to get a comprehensive intake and get a look at all of that stuff. All right, intermodal perception. So let's talk about what that is. Intermodal perception is the ability to perceive stimulation from events or objects by using multiple senses simultaneously. Um, Different senses travel in different pathways. Newborn senses work in concert to perceive objects and events in the environment as stable and unified. An infant can see, hear, and feel his hand clapping, but he recognizes it as one unified event instead of three fragmented senses. So multiple sensors are used to perceive a modal information, a modal information that is not tied to a specific sensory system. For example, musical pitch is specifically tied to auditory for hearing, right? A modal information such as the temporal synchrony, the rhythm, the duration, the tempo, changes in intensity, shape, substance, size, and texture can be perceived by more than one sensory system. The infant can both see and feel the texture of the stuffed animals. Then we have intersensory redundancy. This happens when identical and amodal information, the texture of a stuffed animal, is perceived in synchrony by more than one sense modality, example, sight and feel. At 3 months, an infant can coordinate sight and sound by matching face and voice expression of happy, sad, angry emotions. That is getting us into attachment, right? So sometimes we can have attachment disorders because parents are very good at actually going through the motions and doing what they think they're supposed to be doing. They're cleaning the baby, they're feeding the baby, but there is a mismatch, perhaps in vocals, perhaps in face, like so depressed moms who are trying to smile and their voice is weak. I mean, there's some perceptions going on there at this point. Um, they can separate at 5 to 7 months. You know how we can filter out background noise? So, when you're listening to us in class and, there's other sounds, you're filtering out and focusing, right? And we can do that. That happens at 5 to 7 months. So that's really interesting too. So you can kind of understand where some of these issues start to come in. Toilet training. Woohoo, fun, right? Um, Transitioning, right? Usually between 18 and 24 months. Reward systems work best when toddlers start staying dry at naps, and bowel movements are more predictable is an optimum time for that. And elimination communication. Um, Parents use this method to train their children. So this is a way that is based on attachment parenting, and so parents are actually looking at cues from their child and allowing them to respond naturally to going to the bathroom. They may let them go without a diaper and let them begin to feel discomfort in that process, holding them when they feel like they're about to go and there's a cue, they'll hold them over a bowl or over the sink and make a sound. And proponents of this method said they can learn between 6 months and 2 years of age. So it's a different philosophy to know about. And all of this is important when you have clients who are doing these things or curious about these things. Cognitive development. This is the structure of the cognitive development. Let's talk about the nervous system here. And we, as parents, play a critical role in providing stimulation for optimal brain development. We know about neurons. These are those cells in the brain that fire and fire information. And the trauma research we say cells, nerves that fire together, wire together. And that's why we get the trauma response when, anyway, not to go into too much of that. But a cluster during the processing stage, randomly positioned neurons in the brain will physically move to a distinct place. We have the cerebral cortex. It's just the outer layer of the brain that controls the majority of our ability to understand and communicate. And then you have your parts of the neuron. You have your axon, your myelin. So these are just terms you need to know, and you probably, all of you already know those. We can do a video if we need to, but I don't think we do. So let's talk about Piaget. Remember we talked about him earlier in our process, and we need to know these. So these stages of development are really important, and you need to know them in detail. When we talk about cognitive development, and we're starting into this chapter, I also want to make sure that you are very aware of the right brain development. So from birth until 2 years, the child's brain doubles in size. And during that time, hormones are produced as a result of the social and emotional relationships that the child forms with the primary attachment figure shaping the brain. It's until 30 months of age, the right hemisphere is basically responsible for all that's happening in the brain. It develops more quickly and dominates more brain control than the left. So the right hemisphere develops depends on the sensitive and responsive caregiving. It's pre-verbal. So this is really important because if the baby didn't get what the baby needed up until 30 months, there are going to be issues and triggers in the future because the left brain is not fully developed, and that doesn't start till about 36 months when they really begin to talk. We're talking about a 3-year-old, now they're starting to talk, calling past events, etc. And here is Piaget's stages of development in the sensorimotor stage, 0 to 2 years. So you see here from 0 to 1 month, there are reflexes that are developed with the sensory experiences and human interactions, like the moro and the stroke in the cheek and all the things that we've already talked about. Then we go into 1 to 4 months. Motor activity becomes purposeful and intentional. 4 to 8 months, infants develop simple cause and effect. If they hit water, it will splash, right, in the tub. 8 to 12 months, infants develop object permanence. They know that an object exists even if they cannot see or touch it. So if you had the block behind your back, they know it's just not gone, that the block is actually still behind the back. And 12 to 24 months, infants develop symbolic representation, so they begin to think before acting and have an imagination. So I thought it'd be nice to see something different than a regular PowerPoint I'm constantly showing you guys. Oh, I skipped right over Piaget. Oh, okay, found my slide. So there are 4 stages of development of Piaget, as we already know: sensorimotor, pre-operational, concrete operational, and formal operational. And those are stages of development. But we are just talking about sensorimotor right now. So those terms under sensorimotor, that's just 0 to 2. That's what we're talking about, what I just did another slide on. So you'll need to know the reflexes, the primary circular reaction, which is like a baby bringing the toe up to the mouth, and they like that, and then they keep doing it. Secondary circular reactions when, have you ever noticed when you lean over a baby with a necklace and the baby tries to put the necklace in your mouth or in their mouth or whatever? That's the same kind of thing, and that's a secondary, it continues to happen over and over and over, etc. And then you have the tertiary circular reactions. By 12 to 18 months, the infant has started to incorporate this. This is like dropping the spoon, engaging in physical experiments to see what will happen. This is a good time to limit restaurant visits because, am I going to have a fit? What happens if I have a fit here? What happens if I throw a plate? Um, a lot of physical experimentation. And when the toddler invents new ways to achieve a goal through mental combinations. Um, so you're going to start to see them trying out a lot of things and making sense of, oh, if I do this, then this is going to happen. Toddlers use a high level of strategic thinking to interact with another person when nearing the end of the stage. Um, Object permanence is another concept that is understanding that when the block is behind the back, that it's really still behind the back and it's not just disappearing. It's why peekaboo is so funny at um, certain ages because that hasn't happened yet, and it just makes them like, wow, you disappeared, you came back. Um, so maybe not until about 8 months old does object permanence begin. And the classic study by Piaget and hiding the toy and then allowing them to find it, rehiding the object in a new location. Because of object permanence, the child's compelled to look for the item in the spot of which it was hidden in the first time. I just said this, but object permanence is also the reason behind why playing peekaboo is so exciting for them. It's pretty funny. I'm sure some of you have done that before. Yeah. Information processing. So we know that infants encode information into their brain. They can't encode just a one-time object, but they can when they have a comparison point. So when infants and toddlers were asked to compare the length of a wooden rod to a similar rod they had seen previously, they weren't able to. But they were able to point out a similar sized rod when compared with a teddy bear. So these results suggest infants and toddlers are not able to encode information into their memory when a visible object stands alone. They have to have a comparison, such as the standardized object. We are able, as adults, to encode information within the presence of comparable object. So obviously, with time, our encoding and retrieval is a lot more complex. And once that is encoded into the brain, then it's stored there until it needs to be retrieved, much like a computer system. Um, the way they retrieve that information can be affected by how it was encoded in the first place. So toddlers learned a new word for an object by being shown the object made out of Play-Doh and seeing an adult act out the item's function. The toddlers were then successful at retrieving the word for a new object at a later time. Also capable of recognition, when a new object or event is the same or similar to one that was previously encountered, and they're able to recall, generate a mental image of the previously experienced object without something to stimulate recognition. Memory. Memory is crucial for infants and toddlers, important for safety, right? That's hot, that's dangerous. A lot of modeling, mimicking, right? Remembering they saw something, they're going to act it out. Very important for you to know as a therapist. And there's object categorization. Infants and toddlers can really remember things in categories. So you like what animals are in the zoo, what you know, what are fruit, what's fruit. So categories are easier. Habituation that occurs when shown a stimulus enough times that each subsequent viewing the child looks at it for a shorter time. Um, Toddlers and infants can become habituated in social situations to people's faces, which can contribute to a level of comfort with family. So, like if grandma comes a lot, then that's grandma's not a stranger anymore and may habituate to her and not get upset. Toddlers with autism who show deficits in the social information processing have a more difficult time habituating to faces and pictures than typical toddlers. So, maybe one of the ways that you would test for that. All right, intelligence. Move on. 26. We're almost done, guys. I think we're almost done. All right, let's talk about intelligence. So there's actually a test that is used to decipher infant intelligence, which is interesting, right? Of course, it has three sections like cognitive, language, motor. It includes things like asking an infant to do something, to name an object, stack blocks, etc. There are two sections for parents to complete, which include social, emotional, and adaptive behavior scales. See how do they calm themselves? How do they imitate play? Do they have self-control? And there are also intelligence quotient, as you guys remember from adult tests. Um, Tests for infants and toddlers yield a score called the intelligence quotient. To distinguish these assessments from the type of tests given to older children and adults, this is more termed a developmental quotient versus intelligence quotient. Um, these are not used to predict future success. However, the cognitive and language scales have been shown to predict mental test performance in preschool. These are mainly used for screening purposes, but very low scores could indicate some issues, some learning developmental delays and issues. Living in poverty is obviously correlated with poor intellectual development, like low SES is, as we know, and we think back to the ACEs, Average Childhood Experiences Scale, and think about the impact on those children. And they don't get the enriching experiences that their other peers do. That brings us to early intervention for at-risk infants and toddlers. As I click and click, oh, nice. PowerPoint is choosing now not to respond. I'm going to pause you so I'm not wasting your time. Okay, I'm back in the slideshow view. So it says early interventions for at-risk infants and toddlers at the top. But we know the impact of low ACS on children. So federally funded programs were created to help those children who are at risk for delays. So one of those, and most of you have heard of those, is Early Head Start. This is a program that gives them a head start. So actually, center-based, home-based combination programs. They get physical, social, emotional, cognitive, and language development and high-quality child care. There's also the early intervention program. That is to help children be ready to attend preschool and kindergarten who have developmental delays or mental conditions, physical conditions. And so those are two programs. And then we have some local programs. Gosh, now it's escaping me. But it's like reading programs, and we have the actual um, gosh, it's 0 to 6, and I know it's just escaping me. Some of you are going to know exactly what I'm talking about, but we have several local programs that focus on this initiative to help early at-risk infants and toddlers. At this point, it may be a good time for us to do our forum for Chapter 5. If you're getting used to these, you're knowing I'm putting them at various places in the lecture to make sure that you listen to the whole thing. And often they're coming not out of your text, but another text. Sometimes, I'm switching it up. So here's your form. You're going to have to listen closely. This is the impact of early life stress on subsequent brain development, and it is from another text. So, an infant's brain is especially vulnerable to stress. Responding to stressors is an important aspect of normal adaptation and development. You can imagine many possible sources of stress in an infant's daily life, such as being hungry, being wet or cold, feeling overstimulated, or wanting contact. In the face of stress, the body prepares us to respond by increasing the heart rate, blood pressure, and stress hormones, such as cortisol. When an infant's stress response systems are activated within an environment of supportive relationships, these physiological effects are buffered and brought back down to baseline. The result is the development of a healthy stress response system. You may recall that one contribution of object relations theory is the idea that the caregiver creates an interpersonal environment that helps an infant interpret and respond to stress. Thus, in a caring, responsive environment, exposures to stressors can create neural networks that link the stress responses to systems that can help to soothe and calm the aroused emotional and physical state. However, when the stressors are intense and prolonged without support of a caring, responsive environment, the stress may be prolonged. The accompanying respiratory, circulatory, and hormonal reactions do not return readily to a calm state. Prolonged activation of the stress response system can disrupt the development of the brain architecture, increasing the risk for stress-related disease and cognitive impairment, also known as ACEs, I mentioned first childhood experiences, right? A violent, neglectful, or erratic caregiving environment may be one of the most central sources of this type of toxic stress. For example, researchers studied the brain functioning of 6 to 12-month-old infants who have been exposed to various levels of interpersonal conflict, parental conflict. Higher levels of interparental conflict were associated with changes in the infant's brain architecture associated with more negative emotionality. Another study explored the relationship of infant attachment status and brain development in early adulthood. Secure attachment is known to emerge in the context of responsive and synchronous caregiving. Those adults who have been characterized as having an insecure attachment in infancy were found to have an enlarged amygdala in early adulthood. These and other studies provide further evidence of a link between exposure to a stressful parenting environment and brain architecture. Here are your response questions to the prompt. What are some specific ways that supportive parenting helps infants manage stress? What is an example of a policy or program that might improve the positive interpersonal environment of infants and young children? And as a counselor, so I want you to answer these 3 questions. What are ways that supportive parenting helps infants manage stress? What's an example of a policy or program that might improve the positive interpersonal environment of infants and young children? How does it work? And perhaps go look and find the one that I couldn't remember. That would be really awesome. And also, why do you need to know this as a therapist? Like when you are counseling people, why is this important? What do you think? That's your forum for 5. I hope you'll watch the rest of this video though. It's short. We're in language. We're in language development, guys. We're almost done. We are almost done. We are excited about that. This is almost an hour and I know you're bored. So language is obviously a communication system comprised of symbols. And there are several definitions that you need to know. So just know this. I'm not going to, come on, you guys, semantics, the meaning of words, just know that. Okay, comprehension, language comprehension, you understand the language. Production is the ability to speak. The most important thing probably to know is just understand those different definitions just in case you see them on NCE or quiz. But toddlers can comprehend 50 words by the time they're 13 months old, and it takes 18 months for them to produce 50 words. So that would be noteworthy for you as far as development is concerned. Sequence of language development. So language development begins in the womb. So when pregnant, we know that the fetus can respond or responds to sounds, mom and dad. And there was even a research study where they could distinguish between the words babi and biba played over a loudspeaker over the mother's abdomen, which is really interesting. Crying is important. It's obviously, it gets your attention. And interestingly for us, as we've developed and evolved, we find crying to be highly aversive. We do not like crying. And there was a research study that was done where we were listening to high-pitched crying of an infant and trying to do math problems, and it was almost impossible. So it's very difficult. We are conditioned to respond and not find that pleasant, and that makes sense because we're trying to find out why they're crying, get them to stop. There's also different kinds of cries. There's a hyperphonated cry, which is a much higher hertz, and then can even get up to 1,000 to 2,000 hertz. And it greatly changes our stress response in high arousal, and changes our heart rate and skin conductance. So it's very important that infants can cry because they need to get their needs met. It's important for us to be able to detect it and be able to reinforce or not reinforce the crying. We have cooing, which begins at 2 to to 4 months, which is the oohing and the ahhing and those sweet little sounds. And you go back and forth, and they're like learning to talk, right? And babbling. Then they start to say more like da 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 da, ma 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 ma, kind of things like that. And that's also developmental milestones, and you're checking to see if they are on track or not. Gestures, um, when they're waving bye bye, you see them start to do that at some point, pointing. Um, some begin to point at 9, others don't start till 19 months, so that's why there's always a window of development. Um, Gestures become everyday interactions between 10 and 24 months. Hello, bye bye, request, signaling to be picked up, which is a request, etc. All right. And then the sequence of language development, give your first words, and then phrases, and then of course whining. And gray's 5, but the whining, you still have the whining. So, but you see this development. So single words like mama, then it goes, more milk, want milk, um, between 18 and 24 months. And then telegraphic speech is when they emit non-essential words. So um, I want more milk and more milk, and whining. There's the whining I was just talking about. Woohoo. Theories of language development. We have the behaviorist, social cognitive, and nativist perspective by Noam Chomsky. And these are different. Obviously, we've got Skinner, who proposes that language is based on experience and shaped through operant conditioning, through reinforcement. Since the infant enjoys the responses that babbling is reinforced. On the other hand, you've got social learning theory that an infant learns behaviors such as language by first observing others, modeling the language, and then by imitation. The imitating, unlike behaviorism, the infant's learning does not take place because behaviors are being reinforced by his environment, but rather because of mirror neurons are actively practicing what is seen in the environment. And the nativist, Noam Chomsky, believes the human brain is innately wired for language by means of an inborn system called a learning acquisition device. The LAD, which is the learning acquisition device, contains universal grammar, a set of grammatical rules shared by all languages and hardwired into an infant's brain before the infant even hears a spoken word. Hearing language triggers the mechanism, enabling the infant to understand and speak using these innate grammatical rules. The infant therefore does not need parents to supply intentional language training, making nativism quite different from the behaviorist perspective. In cognitive and language development, the parental influence is important. We know that um, more interaction and more communication can definitely facilitate, but if you respond in a different way, it could slow the language development. There are object-directed vocalizations, pre-linguistic vocalizations that indicate an infant's readiness to learn language. Um, for example, consider when the infant sitting on the mother's lap and seeing a banana on the table says "na." Whether a mother consistently responds to these vocalizations by correctly identifying his object and saying banana, which connects sound and object, or whether she responds with an unrelated word such as nap, will make a big difference in vocabulary. Study found that when mothers of 9-month-old infants routinely labeled their children's object-directed vocalizations correctly, the children had larger vocabulary sizes at 15 months than did children whose mothers generally responded with a word that did not match. And we know there's a big gap with socioeconomic, and thinking about maybe perhaps a single mother in poverty is probably not going to take the time or have the time, the luxury to say banana. And she's working maybe third shift and stressed, and there's not enough food, and maybe the lights are going to get cut off, and there's not a lot of time for that. So there's a big gap depending on socioeconomic status. And there are cultural variations in language um, throughout the world. In some cultures, we have tons of words for certain things. In other cultures, they don't. They have lots of ways to say certain things. I think the book talked about colors. I think that's what it was. Yeah. Like in Papua New Guinea, they have 5 words for colors, and we have over 3,000 words to describe colors in English. So you can see how that would affect language development and change it. I like these. Just consider these. You already had your form response, but think about how, as a counselor, might you work with clients who do not follow recommended medical advice, such as using formula over breastfeeding or deciding not to vaccinate their children. Maybe write on that too if you want to. Think about infants you know. In what ways do their physical and cognitive development differ from the sequence described in the chapter? And we made it. Chapter 5. You guys are rocking and rolling.